Welcome to In the House. My name is Mark Shiver, and I'm excited. We are back. We took a little break for the holidays and the beginning of the year and got the legislative session in full swing. And so we are back, and our first guest in 2023, none other than Representative Reeder from, well, down east. And you're also a medical doctor. So, Representative Timothy Reeder, welcome to In the House.
Thanks very much for having me. I'm really excited to share some thoughts with you and answer a few questions.
Yeah, so this is going to be a kind of a get to know you edition of In the House, and I'm excited about it. I've been excited ever since we set this up because I have typically been talking to veterans, guys that have been in the General Assembly for multiple terms, but you're my first termer, so I'm excited to have you on. And in that regard, Representative,
everybody else was busy, huh?
No, I wanted to ask you right out of the gate, what prompted you to want to do this? You're busy. You're a medical doctor. Obviously, it's not like you're sitting around with nothing to do. So, what compelled you to want to serve the people of your district?
It really was a desire to make my community better. I think that I have done a lot in medicine. I've been able to help individual patients and families, and I love doing that. I love taking care of patients, but I love the opportunity to try to create a better community, a better society for us, and have a much wider impact. And so that's what drove me to do this. And I think if you ask the other legislators up here, there really is a desire to do good work, and that's what brought me here.
To your point, I will say this, that sometimes you'll sit around in a group of people and they'll start criticizing, people in the General Assembly or politicians in general. But I've been down there in various forms. I worked for the Senate, I worked for the House, and I can honestly say I think what you just said is true. People genuinely want to do good things. I don't think you have a bunch of people going down there trying to be crooks or, bad people. They genuinely want to help. I think that's true.
I think that's absolutely true. And we recognize, and there's problems that we're trying to solve, and irrespective of which side of the aisle you're on, we're all trying to solve problems. Mm-hmm. I think we might have very different worldviews of how we go about solving the problem, but there's people are authentic here, and they're here to really do good work.
That's a good point. I'm glad you brought that up, and I agree with you wholeheartedly. Now, tell me a little bit about your medical background, what you do. Are you still able to work as a physician while you're serving in the General Assembly?
So I am. I'm a state employee, so I'm a double state employee. So I work for East Carolina University. So I'm on the faculty of the School of Medicine, the Brody School of Medicine in Greenville. And about 40% of my time for that job is seeing patients. The rest of my time is administrative and education. So I still see patients in the emergency department. We're recording this on a Thursday. I'm going to be in the emergency department this weekend. So I'm going to do 2 shifts this weekend. And so It is challenging continuing to run a medical practice and see patients and doing this work. The nice thing about the emergency department, for good or bad, is we're open on nights and weekends. So I'm able to when we're not up here in Raleigh in session, I'm able to do some clinical work back home. And so I'm still trying to figure out how to balance all this with this work, because it is a lot of time. We joke that this is a part-time legislature that pays less than part-time, but it's full-time work. And so that's a challenge, but not so different from a lot of the members up here.
Yeah. Well, I used to have to when I worked for Senator Tillman, and by the way, he passed away recently, and that was very sad. He was a good senator, but when people would call and I would answer the phone for his office, they'd be like, "I know you're making $200,000 a year." They confuse you guys with the people in Congress or whatever. And so when you tell them it's not anywhere near that, they're very much surprised. But to your point about clinical work and working on the weekends, working at night, the legislature last session appropriated right much funding for the Brody School of Medicine, and I think there's going to be a big expansion or something like that. So I know you're excited about that.
Yeah, we are limited right now in the size of our class because we don't have so many chairs in our classroom. The medical school has been in the same building since its existence, and the entire building has become outdated and really too small. We very much want to fulfill the mission of why the Brody School of Medicine was created, and to increase the number of primary care physicians in North Carolina, and particularly Eastern North Carolina. And we've done an incredible job over the years of doing that. And if we can expand our class size with a new building, that will allow us to produce more physicians who will likely stay here in North Carolina. And so the work of the legislature, it was passed last year for sure. That work has gone on over years to try to make the argument for why it's important to expand that School of Medicine. And so it will give us bigger classrooms, bigger laboratories, a big simulation center. Medical education has changed a lot in the decades that the Brody School of Medicine has been in existence. And in the technology for educating and the resources in this space has changed a lot. And so this building will really allow us to teach like we need to for the 21st century.
Wow. Well, I know you're excited about that. And so while I have you on today, as someone in the medical profession, I think I need to dive into the whole topic of Medicaid expansion. Now, I have followed this probably more than most people. That's not to say I understand. I understand Medicaid, but boy, what a thing! It's so much money to try to care for folks that need care, and expanding is going to be a lot more money. The federal government has said we're going to take care of that. So recently, an opportunity to look at expanding the program here in North Carolina, something that the Republican majority has resisted for right much time now. But all of a sudden, last session, oh yeah, it's a good idea, let's do it. And Speaker Moore said, we're going to wait until the long session where we can talk about it, study it, instead of making a hasty decision. So it looks like, based on recent votes and bills being passed, that you guys are going to go for it. Yeah. So how do you feel about that?
Yeah, so I'm supportive of expansion, and we passed it in the House already, and now it's going to go to the Senate where we'll have some additional debate on it. In the area that I work, so my district is in Pitt County. It is a rural, underserved, impoverished region. Medicaid expansion really provides a lifeline for a lot of the most vulnerable patients that we take care of. The number of people who lack insurance, lack access because of that lack of insurance is very high in the patients that I take care of. And so Medicaid expansion is going to allow more of those people to have insurance and access to the healthcare system. It will help support across the state rural providers, rural hospitals, to give them a little bit more cushion financially to help deliver the care that is so needed. We know that if you can get your care locally, that's better all the way around. And so it's really important for us to support medical providers, physicians, and hospitals in rural settings. And so I was very much in favor of it. So you can make an argument from a clinical standpoint why it's good. From a financial standpoint, North Carolinians have been sending money to Washington, D.C. for years, and that money has been going to other states to fund their Medicaid expansion. Wow. This will bring billions of dollars into North Carolina to help support and help grow our economy, really. I think the Rural Center said that there's going to be about 80,000 new jobs created as a result of Medicaid expansion. And so from a care standpoint, from a financial standpoint, I think those are all very good things. The AMA did a report, the American Medical Association report did a report a number of years ago, said that every physician offices has about for every physician has about 17 jobs that they're supported from that. And so if Medicaid expansion allows us to get a physician into a rural community who might otherwise not have been there, that's an economic driver for that community. In addition to providing care locally where we know it's best done. So there is all sorts of reasons why I think and was supportive of Medicaid expansion. I know that it took North Carolina time to do this because North Carolina Medicaid was struggling and the department overseeing that was struggling. I think what changed a lot of minds is when we went to Medicaid managed care a few years ago and said, we need to do something different with how we manage these patients. And I think that gave more confidence to legislators that we could accept and expand Medicaid.
This might be a dumb question, but you said managed care. It made me think, are we still going to be able to keep that going forward as when the program expands?
Yep. Those patients who will now come into Medicaid, they will be in those managed care plans.
So that's a good thing. Yeah.
That's the hope, that we can manage those costs, because I think the legislature previously, there were years where there was huge budget excesses and overruns in the Medicaid plan. And I think that legitimately was a real important factor why North Carolina was reluctant to just expand Medicaid, because the costs were hard to control. Yeah,
no doubt. Well, it's exciting. And I'm sure that those people that find themselves, particularly, as you said, in the rural areas of North Carolina, that they're able to get insurance, and boy, that'll be something for them to be able to be excited about, to be able to get primary care, and to have a primary care doctor, to be able to go and get physicals, and something that they might not ordinarily do because they didn't have the money. And the goal is that if you have access to care and you can get those preventative services, that ultimately in the long run, you're going to relieve suffering and you're going to increase life expectancy, you're going to increase health. That really is the hope of managed care Medicaid and the Medicaid expansion. Well, you mentioned Pitt County, and I should have said you're in District 9. That's where you represent, and the eastern part of the state. And I wanted to ask you about the process down there. When you were you prepared for how many people would be coming by your office Tuesday, Wednesday, and Thursday while y'all are in session? It's a crazy place down there with all the lobbyists and the citizens and the special interest group and people from down, from back home. Did that surprise you at all? I'm not sure if I was surprised. I'm not sure I was completely prepared. I wasn't sure exactly what to expect when I got up here. And I look at it in a couple ways. One is it's intellectually stimulating to learn things. So I learned this week about wastewater treatment plants, and I learned about I didn't realize there was so much nuclear power in North Carolina. So those were really interesting. We had briefings all week on the Department of Health and Human Services, which was fascinating. We had the chief economist for North Carolina give us a briefing. So all of that, just from an intellectual learning, that's been fascinating. Wow. We had a group, I think it was this week, all the days are running together, but a group from one of the elementary schools from Pitt County. So we had a whole group of fourth graders. So I got to see them and take their picture and meet them. So that was fabulous. I mean, it's an exciting time. And I just finished a tour of the Capitol building. I'm very much, I love history. And so one of the docents gave me a tour of the building and talked to me about the building and what was all in it. And again, that's fascinating to me. Yeah. So, and I think it helps me be a better legislator because I'm more connected to the history of what we're doing. I remember during our orientation, there was 24 of us who were freshmen, new people, and we were on the floor of the House. And in the conversation was about, there's 10.5 million people in North Carolina.
And in talking to us, you are one of the 170 people who are entrusted and responsible for making decisions that affect millions of people.
Wow.
And that's an awesome responsibility. And
Yeah.
so for me, taking the tour of the building was really to help connect me to the history of what we're doing up here.
That is when you start thinking in terms of those numbers, that really can be overwhelming. You know, you've got a lot of responsibility, big budget, billions of dollars, and how are you going to approach, you know, how that money is appropriated? Not that you make that final decision, but you're part of the process. And so I want to ask you, before we run out of time, I did want to ask you, you said you had some fourth graders from your district that were came by for a visit. And has it dawned on you yet, or has it hit you yet, how important it is that you can talk about nuclear power, you can talk about the economy, you can talk about all this other stuff, but when it comes down to it, the most important thing you're doing is representing the folks back home. Has it hit you yet about how important that type of service is? And have you already experienced people calling saying, hey, I got a problem with the DMV, or I got a problem with this and that?
I haven't had any of those calls. State government's working perfectly. No, we have. And I think that one of the nice things that we come up here on Tuesdays and Wednesdays and Thursdays, and we're engaged in this, but the connection back to the district is really important. So in my drives up here to Raleigh from Pitt County, I'm on the phone. I was talking to people in the district because you want to connect the work that we're doing here with folks and problems back home. So we had tours of our wastewater treatment plant back home to see what it is that they need, how do they best support the citizens. We've had calls about the DMV, about the healthcare system, and we've been able to connect some of those.
Yeah.
I think, you know, I'm still learning how to navigate that bureaucracy, and I knew that the government was big and bureaucratic, and I'm just starting to understand the magnitude of that. I think in general, the people who work for state government are doing that because they are trying to work and solve problems. And oftentimes what we can do for constituents is figure out who the right person is, because sometimes it's that nameless, faceless bureaucracy where people just don't know where to start.
Yeah.
And one of the things that being a member, being a representative, we have people to call who are responsive to us in a way sometimes not for the constituents. So I think that that's one of the important things that I say consistently to the folks back home. My door's here, my phone number's here. I've got my cell phone on my business card. If you're struggling or you need some help with state government, I'm here as your representative. And I think that is the most important thing that I do up here.
Absolutely. Absolutely. Well, that's outstanding. I think that the people that you represent will appreciate that more than you'll ever know. That they can have confidence that you are here for them. So I want to ask you one more question.
Sure.
Time just flies, and I could go on and on because you're very interesting to talk with. And yet, when you think about, and this question came based on something that you had said, you're over here getting the wastewater treatment information and nuclear power and economics and Medicaid and this and that and all these variety of topics. When you came down here, you had a specific goal. What is that goal, and is it going to be able to be something that you can stay focused on pursuing, or are all of these other things, do you think, just going to grab your time and keep you from being, I mean, in other words, are you confident you're going to be able to do what you went down there to do?
You're right. There are a lot of big, complicated issues that come up in the legislature. And one of the things I knew coming up is I can't be an expert on everything. And there's only so much time and energy in the day. And so we have to rely on our other members, their expertise, and the committees to do a lot of the hard work to make sure that the laws that we pass, the regulations that we do, the oversight, that someone is doing that work. Agriculture is the most important industry in Pitt County, and I don't know a whole lot about agriculture. I know that farmers plant things in the ground and they grow and they cut them down and they sell them. If I need to know about agriculture, I have other members and other people back home who I can rely on to say, help me understand why this is important, what the issues are, and where I should be spending my time and how I might vote. I have to rely on other people. I think you're right. If I'm going to be an effective legislator, I have to focus. And certainly with my background of health, that's an important issue to me, but also education. I'm on faculty. I'm a teacher at heart. And so those things are very important to me. And so that's where I'm going to be focusing a lot of my energy. But I also know that, especially in the rural areas, economic development and jobs are very important. And it's all well and good to expand Medicaid, and that's a bridge. But what we really need to do is make sure that citizens can have I think everybody wants to have a family, someone that they love and care for. They want to have a job to provide for the family. They want to educate their children, if that's their choice, and they want to have a long, happy, productive life. And so my job as a legislator is to try to create the environment where people can be successful and do those things. And so all of those things tie together. And the things that are important to me are economics and health and education. And those three items are linked together really well.
Well, that's fabulous. I couldn't have imagined anything better than the way you just described what you are trying to do and what you need to do as a member of the North Carolina House of Representatives. Representative Reeder, thank you for being our guest on In the House. I felt like it was a tremendous interview. I would like to do it again. And as you begin to just really get in there and a few months from now, you'll have a totally different perspective, I'm sure. I got just a few seconds. I meant to ask you, you have sponsored a bill. It's a calendar bill. You said that you're interested in education. Briefly, tell us about that.
Yeah, so it was my first bill that was filed, passed through committee and got through rules and passed through the House. It's allowing the local school board to set dates for the calendar. Right now in North Carolina, it's very set. The difficulty in our area is that for students come back after Christmas, they have to take exams soon after Christmas, and it doesn't allow students to have a break. The other issue is that a lot of our high school students take classes at the community college, and that community college and the school, the calendars don't align. And so that makes things challenging. In our district, our school board did a survey of community, and 90% of them wanted flexibility in start dates. And so that's a perfect example of something that I heard very, very much from the district, from teachers, students, everybody, that they wanted this. So I was happy and proud to be able to sponsor that as my first bill. And hopefully it will get to the Senate and they will love it and pass it, and it will move forward. We'll keep our fingers crossed.
Yeah, and you'll frame that thing if it gets passed, because that'll be your first one.
Exactly.
Absolutely. That's marvelous. Well, Representative Reeder, thank you very much for your time and for being our guest in the House.
Thank you very much.